in Johannesburg and right next to the inner city. My day has changed substantially since the onset of COVID. South Africa's had one of the most strict lockdowns in the world in terms of restriction on people's movements and in terms of the army and the police and everything else. So my workday has essentially been sitting at home on Zoom calls for 3 solid months. I've had periods where I'm allowed to go out to shop. There's been a slight relaxation in the restrictions in terms of who I can visit and where I can go and what I can buy. But essentially, my workday is sitting here having Zoom calls and working on my laptop. So it's very different from my existence 4 months ago, which was outdoor meetings in conventional offices, my clinical trials unit. The rest of my unit, though, is slowly reverting to a form of normal. So around me in central Johannesburg, the area immediately adjacent to where I live is one of the most densely populated areas in Africa. In fact, an area called Hillbrow and Yeoville, and the inner city Johannesburg essentially. And in terms of stuff that's changed there, we've seen a dramatic change in people wearing masks. There is an awareness of distancing. We don't have the American politics around masks, so it's far more ubiquitous, and we don't have the kind of ideological baggage attached to them, although there are people who don't wear them or don't wear them consistently. The physical distancing has taken hold quite firmly amongst many of the shops around me. The government was obligated, well, not obligated, but had committed to food parcels and to a whole range of social support, which has been very unevenly distributed. So people are very scared. We have seen an uptick in the number of beggars, certainly in the area, and just judging from my anecdotal experience, people approaching me who I know, who don't have money, security guards, domestic workers, and that. It seems like outside of, within sort of working class people, there's a great deal of suffering happening at the moment. So what I would say to people working in global health is use the lessons of HIV. South Africa has been, to my mind, a very, very flawed response. And we just haven't learned the lessons of HIV, of TB, of certainly in South Africa, hysteria, of our mass vaccine programs. But getting social buy-in is not that difficult, but you have to explain to people why they need to do something. You can't simply do this on high demand and say, get your vaccine and carry on. And HIV, follow the following things, take your medicines, practice safe sex and stuff. You have to explain to people the science behind it. South African government has not used that experience whatsoever. It also hasn't relied on advice from its experienced people. South Africa in many ways and I'd argue a lot of Africa actually has a lot of pandemic response experience, if it's not around malaria and HIV, a whole range of everything, Ebola. And, we've learned stuff from that. We've learned you don't lock up people. You don't start threatening people with incarceration when they test for something. You try and get as much of that social buy-in voluntarily as humanly possible. And I would argue that other people must start thinking about that to use those experiences. And South Africa, as I said, it has not. It's rather relied on legislation, on enforcement by the police and the army. And what we've seen is erosion in the social compact for many of the interventions, because it's been rather an iron fist than an explanation of why somebody should do it to protect themselves and their families, their loved ones, their work colleagues, and the general population.